मॉर्फिन का कॉन्ट्रा इंडिकेशंस क्या होता है? Emphysema, bronchial asthma, head injury, because morphine can lead to respiratory depression, which is not good in an asthma patient or a head injury patient or an emphysema patient. But if there is a congestive heart failure leading to pulmonary edema, there morphine is indicated. But emphysema, bronchial asthma, head injury, typically morphine is contraindicated, is what you have to basically remember. So, doctor, contraindications of the morphine. This is one PowerPoint slide that you need to remember. Extremes of ages. If he is a neonate, no morphine. Very old person, no morphine. Bronchial asthma, respiratory insufficiency like emphysema, don't forget. Head injury may, no morphine. Similarly, if the patient is in shock and hypotension, no morphine. Undiagnosed acute abdomen, don't try to give morphine to kill the pain if it is undiagnosed acute abdomen, because morphine will lead to the spasm of the biliary tree. Suppose if the acute abdomen is because of a biliary colic, then if you try to give morphine, then that can worsen the pain. Similarly, renal failure, liver disease, hypothyroidism. Hypothyroidism is also considered to be one of the important contraindications of the morphine. And if he is an unstable personality, don't give the morphine, is what you should remember. Now, doctor, yes, which is not a contraindication, the therapy of opioids. Once more, the same old question of the examiner. Typically, constant pain, severe constant pain, we very much use morphine. But head injury, impaired pulmonary function, if you are using an agonist and a mixed agonist antagonist, they are considered to be the contraindications for the administration of the morphine. Bhaiya, abhi aa gaya jara batti marne wala cheez. What are the natural opium alkaloids? Morphine, codeine. Please don't forget. इतना important topic है. Second highest high yield topic in last 15 years of MDS entrance exam question bank. But don't forget, even MDS basic sciences question bank topic wise अगर revision करें तो a lot of questions will also come back in NEET PG 2020. So be very sure. Now doctor, सेमी सिंथेटिक होता है डाइएसिटाइल मॉर्फिन, जिसको कहते हैं हेरोइन. Then what are synthetic opioids, doctor? You have phenylpiperidines, that is pethidine, and its product meperidine, and their congeners diphenoxylate and loperamide. They're all semi-synthetic opioids. Fentanyl और उनके सहोदर, so fentanyl, remifentanil, alfentanil, typically are all synthetic opioids. Similarly, phenylheptylamines, that is methadone and congeners, propoxyphene, dextropropoxyphene. Then you have pentagocin, which also is a synthetic opioid, and levorphenol and butorphenol, which you have to ultimately remember. So, bhaiya, a classification of the opioids is one of the favorite questions of the examiner. Now, where do we use opioids, doctor? Keep punching. Some points that come to your mind, no? Please punch. Right? That way what happens is your preparation become much more proactive. जो भी रीडिंग रूम में पढ़ रहे हैं, यहाँ वॉमिट करने के लिए there's a very good forum where across the country almost 200 plus students attend this live interactive session. This is a wonderful opportunity for all of us to read together. When we read together, memory बहुत अच्छा रहता है, क्योंकि If you are answering A, somebody answering C, उसको देखना चाहते हैं हम, what is going to be, whether that guy is correctly answering or not. That way our memory improves. So that is the whole idea of this online sessions also, doctor. Online video conference where some of the students can join the video conference and can tell their answer vocally. That's another way. Easily you will remember. Arey, Anu that particular day wrongly answered. She was telling that was the answer. That's how we will remember in exam very easily, right? So Yuvraj says speedball, cocaine plus heroin. Very good. Heroin is also called smack. Very good. युवराज तो एकदम ड्रग धंधे में बहुत गर्मा गर्म है. Pethidine is the treatment of choice for the post-operative shivering. Excellent points. Very good points. So morphine is analgesic for severe sharp visceral pain. Similarly, myocardial infarction, angina, burns pains, fracture of long bones, morphine. Cancer pain, morphine. Acute pulmonary edema, morphine. Please don't forget the indications of the morphine. Bhaiya, pethidine kya hai? It is a good analgesic similar to morphine. It is also typically used for epidural analgesia for the obstetric labor. We use the pethidine is what you should remember. Methadone. You want to do the de-addiction of heroin or morphine? Methadone is very good. So what are the side effects of all these opioids, doctor? Once more, please don't forget. Euphoria, nausea, vomiting, respiratory depression, urinary retention and pupillary constriction, meiosis. Side effect is meiosis. Withdrawal में midriasis होता है. Please be very sure. कल के एग्जाम में फेवरेट क्वेश्चन है. Withdrawal में होता है midriasis. Withdrawal में midriasis. Withdrawal is midriasis. Constipation is a universal side effect of all opioids as a class. They lead to development of constipation is what you need to remember. So opium kya hai, doctor? Opium is that white latex by incision of the seed pod of the Papaver somniferum. Naturally occurring are morphine and codeine. Synthetic hota hai pethidine, fentanyl, methadone, loperamide. Opioid antagonist hota hai naloxone, naltrexone. Very important. Mixed agonist antagonist. You should remember pentajocin is what I want to underscore to all of you. Excellent. Ajay Maurya, absolutely rocking. Pentajocin causes a increased myocardial oxygen demand. That's the reason you will prefer a morphine rather than pentajocin to relieve the pain in case of MI. Now, what are the various receptors, doctor? Mu receptor, kappa receptor, delta receptor. You should be very sure. So, mu is involved in supraspinal analgesia, euphoria, sedation, respiratory depression, pupillary constriction, and a constipation. They are all because of the mu receptor. Once more, one of the favorite MCQs of the examiner. Bulna nahi. Every subject में थोड़ा पट्टी मारने वाला चीजें बहुत good number ही होता है. Examiner is going to ask you what is the specific function of each of these receptors. इसलिए you need to remember. So the decreased GI motility, pupillary constriction, respiratory depression, then that's all because of the mu receptors. Spinal analgesia is the kappa and delta. Kappa and delta receptor. And the reward reinforcement, they're all because of the delta receptor of the opioids is what you need to remember. So if you look at the various CNS functions of morphine, analgesia, sedation, euphoria, respiratory depression, and all opioids universally are antitussives. They depress the cough center A good number of antitussives have the opioids like codeine, etc. So please don't forget once more, extremes of age, asthma, emphysema, head injury, hypotension, undiagnosed acute abdomen and renal failure, liver disease, hypothyroidism, unstable personality, morphine nahi dena, nahi dena, nahi dena. Now, nausea and vomiting associated with the opioid analgesic. Why do they happen? Obviously, they stimulate the chemoreceptor, triggers on. So, doctor, this is one important फुटवा आप फोटो लेने का फुटवा आ गया. So be very sure. Alcohol, typically slurred speech, and if you withdraw, you get tremor, tachycardia, delirium tremens and seizures. Amphetamines, their intoxication lead to psychomotor agitation and mydriasis. Toxicity lead to mydriasis. Whereas opioids ka toxicity lead to meiosis, withdrawal lead to mydriasis. Amphetamine withdrawal lead to depression, lethargy, excessive sleep. Barbiturates. Sedation, respiratory depression and toxicity, anxiety, cardiovascular collapse and withdrawal. Benzodiazepines. Respiratory depression but not as bad as barbiturates. They have a better therapeutic safety. Whereas withdrawal will lead to anxiety, seizure and tremor with the benzodiazepines. Cocaine, psychomotor agitation, toxicity lead to meiosis. That is the point. Amphetamine toxicity lead to mydriasis. दोनों सब्सटेंस अब्यूज है. इसलिए कल के एग्जामिनर क्लिनिकल विनेट देता ना, उस क्लिनिकल विनेट में बोलेगा पेशेंट के वर्क्स इन सॉफ्टवेयर कंपनी, he has a substance abuse, and typically meiosis है तो cocaine, mydriasis है तो amphetamine. That is very important to recognize in the tomorrow's exam. Yuvraj is proposing golden urine in amphetamine, and Sanjana is saying LSD can cause flashbacks and bad trip, and Yuvraj is saying tactile hallucinations, Magnan symptoms classically are seen in alcoholism. Then Sanjana is proposing phencyclidine is also called angel dust. देखो कितना शानदार contribute कर रहे हैं हमारे classmates. That is how our combined study should go forward. That is the way you will remember more effectively rather than being a passive listener of the face-to-face classes, costly weekend classes, crash courses, or sab bakwas kind of, let me tell you, that will only kill your time, energy and your inspiration. 1000 or 500 students के बीच में बैठ के without much of interaction, day-long session, that will actually kill our spirit to prepare. So that is the reason, east or west, what is best? YouTube live online interactive class with Dr. Murli Bharadwaj. Agreed? Agreed. Now Dr. LSD, one of the favorite MCQ of examiner मैं पूछता हूँ, मैं बोलता हूँ आपको, no withdrawal symptoms with LSD. Favorite MCQ. किसको withdrawal नहीं रहता है, withdrawal symptoms नहीं रहता है. Marijuana, no withdrawal symptoms. That is what you should remember. Then opioids, they lead to CNS depression. Once more, opioids also like cocaine, create meiosis in toxicity. Then phencyclidine, there is a psychomotor agitation, nystagmus, belligerence. Whereas phencyclidine withdrawal will lead to depression and memory loss.